Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I'm Yurika Septianingrum from Doctoral of Nursing, Faculty of Nursing, Universitas Airlangga, Surabaya. I will present our study with entitled Correlation Between Family Support and Self-Efficacy in Stroke Survivors. Globally, more than 62% of all stroke events are ischemic strokes. More than 77 million people living today have an ischemic stroke, and 3.3 million people die from ischemic stroke each year. It's proven by a study, Skepanska, show as many as 56.57% of stroke patients had low self-efficacy, whereas the lowest was in patients whose families didn't have the capacity to care. We know that low self-efficacy causes patients to be unconfident and unmotivated to carry out daily living activities. A low level of self-efficacy is also a driving factor for depression during the first 2 years after a stroke and decreases the quality of life. Good family support can prevent stressors from emerging in patients and boost self-confidence so they can effectively handle their conditions. So this study aimed to analyze the correlation between family support and self-efficacy in stroke survivors. Our design is a cross-sectional study, was conducted in the neurology outpatient ward at Rumah Sakit Islam Jemusari, Surabaya, and our sample 71 stroke survivors who met the inclusion criteria were chosen using pervasive sampling, and we use 3 instruments to collecting the data. First, a demographic data questionnaire, second, the family support questionnaire, and the last, the Indonesian version of the stroke self-efficacy questionnaire. We analyze the data using Spearman row test with a significance level of alpha less than 0.05. And our findings show that there was a significant relationship between family support and self-efficacy in stroke survivors with p-value 0.0. In addition, the strength of relationship between the two variables show moderate, with R 0.58. The relationship between family support and self-efficacy was positive, which means that the higher the family support, the higher the self-efficacy of stroke patients. Our findings show that there is a fairly strong relationship between the two variables. The higher the family support, the higher the self-efficacy of stroke survivors. There were many benefits of family support for patients and families, so it is expected that nurses will be able to provide patients and families with support strategies and information such as leaflets or booklets, posters, or something like that. Home visit, follow-up phone calls, practical training, family participation in exercise, and also counseling. We thank all the participants and their family for participating in this study. We also thank to Rumah Sakit Islam Jemusari, Surabaya, Faculty of Nursing Universitas Airlangga, and Faculty of Nursing and Midwifery Universitas Nahdlatul Ulama Surabaya for facilitating and supporting this study. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.